Starting with supplements, how do we know if supplementation is required in the first place?
Well, I think it's an individual decision, and in some cases may not be needed. But when we're dealing with folks that are dealing with chronic pain, migraine, there's typically a burden on the body to help deal with that pain, and usually it creates inflammation, oxidative stress, where it increases needs for antioxidants. So even in a best case scenario, a wonderful diet, there's sometimes additional needs to really deal with the burden of that migraine. And so in many cases, we look to that because it's a self-empowerment, self-efficacy choice. It's something that patients really want to do to maximize everything they can do to deal with the migraine.
Well, I know we're all trying to eat clean, but can't we simply change our eating habits and achieve the same thing?
It's all about the foundational diet. And even if we do take good supplements, if the foundational diet is not healthy enough, doesn't have enough fiber, fruits, vegetables, good healthy oils, then you're not really going to get much benefit from the supplement. At the same time, making small tweaks in the diet can make some changes, just increasing the fiber. We know there's some recent evidence that for every gram of increase in fiber, there's a similar 1% decrease in migraine burden. So you do get benefit from every incremental change, but we can't really rely just on the magic bullet, i.e. the supplement, to outdo a not so healthy diet.
So, are there certain minerals or vitamins that are especially difficult to get with sufficient quantities of from our diet that might be relevant for people with migraine?
Yes, I think it's really interesting. We know in a lot of the evidence-based guidelines, the supplements that do come up often, like magnesium and the B vitamins like riboflavin and CoQ10, those deficiencies actually can start very early on the migraine journey. There's studies like Dr. Hershey and colleagues found that by the age of 13, about a third or more of patients with migraine were already deficient in CoQ10. So imagine if you're dealing with migraines for decades, what that's doing to your energy stores. And CoQ10 is really important for not only preventing migraines, but also reducing fatigue, helping your heart and brain work functionally, so work optimally. So we know that is an important piece of the antioxidant puzzle. We know minerals like magnesium and zinc can also be depleted. In some cases, also iron, especially in women.
Interesting. So, are all supplements created equal?
We know, unfortunately, that the current regulations by the FDA for supplements are very different than prescription medication. So we're really dealing with a buyer beware approach where we really need to educate ourselves when we go to the store